So, I am Dr. Adanma Ekenna, and I have gist: typhoid fever. Typhoid fever. Everybody knows typhoid fever, I'm sure. So, but I'll just share a few interesting things with you. Typhoid fever is caused by bacteria, Salmonella typhi. Okay? And then the symptoms of typhoid can be things like high fever, malaise, that is tiredness, headache. It can even cause constipation or diarrhea. And sometimes some of the organs in our abdomen, in our tummy, become bigger, like the spleen and the liver. Guess what? Everything I've said is similar to malaria. So when you have typhoid fever, everything I've said now just looks like you have malaria. No wonder everybody says they have malaria and typhoid. How does one get typhoid fever? How is it transmitted? Now, before anyone can say they have typhoid fever, they must have a question about the source of food, that is where they get the food they eat, or the water that they drink. Because when food and water comes in contact with somebody that has typhoid fever, whether they know it or not, then the bacteria will enter the food and the water and then cause the disease for someone else. Again, you know how we have farms where we plant our vegetables, our green, our ugu. Sometimes when we are doing that, some use artificial fertilizer, right? But some others use feces, night soil like we call it. So when that night soil is from someone who has typhoid fever, and then you use it to grow those vegetables can also become contaminated. And if somebody eats those vegetables without washing them, the person also comes down with typhoid fever. And then for the last one, everything that comes from milk products, like maybe like cheese or even milk itself, especially for those of us that milk our goats or cows directly and then drink it, right? That one, if the animal also is infected, the person drinking the milk can also get infected. So now you know how typhoid fever is transmitted. So, how can typhoid fever be treated? With antibiotics. But here's the thing. To make a diagnosis of typhoid fever, I'm sure every one of us, we go to the labs and they do tests for us, right? But reading the result of that one test is not the way we should make a diagnosis of typhoid fever. So I say, if you have any symptoms that will make you suspect or feel that you have typhoid fever, please meet your doctor for proper diagnosis and then prescription of your antibiotics. How do we prevent typhoid fever? Like we earlier discussed, that means our emphasis should be on our source of water and then our food preparation, right? So if we drink clean water, make sure our water storage cans and the source itself, they are clean, they are well sanitized, then we're good. And as well as our food, we mentioned milk. You remember, we mentioned vegetables. So if you wash our vegetables with clean water and salt when we buy, instead of eating it straight, and that means we are covered, right? So that is the way we can prevent typhoid fever. If you have further questions, please call the number on your screen or visit any health facility nearby. Thank you for listening. I am Dr. Adanma Ekenna. Bye.